Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder if there is a way to make your therapy sessions work even better for you? Well, this new study might have a clue. Imagine going to therapy and having a system that helps your therapist understand exactly how you are doing, not just based on how you feel that day, but with real data. This is the idea behind something called measurement-based care, or MBC for short. It is like having a progress tracker for your mental health journey. Basically, it means regularly checking in on how you are feeling, how you are functioning, and how you are connecting with your therapist. This information is then used to guide the therapy, sort of like a GPS for your mental well-being. Studies have shown that using these feedback systems can lead to better outcomes and fewer people dropping out of therapy. Now, an exciting new system called the Greifswald Psychotherapy Navigation System, or GPNS for short, has been put to the test. It is a digital tool that asks patients a few quick questions each week about their symptoms, their relationship with their therapist, and how much they're understanding their progress. So, how did they figure out if this GPNS thing actually works? They looked at a bunch of people, 261 to be exact, who were getting therapy. What is really cool is that they used a clever trick to try and understand the real impact of using the GPNS. They took advantage of a policy change at a therapy clinic. Before a certain date, using the GPNS was kind of optional, up to the therapist. But after the 1st of December 2021, it became a requirement for new patients. This policy change, which wasn't about therapy itself but about administrative reasons, acted like a natural experiment. It allowed the researchers to compare people who started therapy before the mandate versus those who started after. They used a statistical method called an instrumental variable approach. Don't let the fancy name scare you. Think of it like this: the policy change is like a nudge that influences whether people use the GPNS, but it doesn't directly affect how well they do in therapy except through its effect on using the GPNS. This helps them isolate the true effect of the GPNS itself, separating it from other factors. They made sure their experiment followed some rules. First, the policy change had to really influence whether people use the GPNS, and it did. It dramatically increased its use. Second, they assumed that people weren't deliberately doing the opposite of what the policy suggested. And third, they assumed the policy itself didn't change anything else about the therapy except for the use of the GPNS. So, what did they measure? They looked at two main things after the therapy was over: symptom severity and personality functioning. Symptom severity was measured using a well-known tool called the Brief Symptom Inventory, or BSI for short, and personality functioning was assessed with a scale called the Level of Personality Functioning Scale, or LPFs. Using their fancy Bayesian instrumental variable approach, they crunch the numbers. This method is pretty neat because it lets them look at multiple outcomes at once and even account for things they can't directly see, like shared patient or process-related influences. And here's what they found. The GPNS made a real difference. Patients who used the GPNS had significantly lower post-treatment symptom severity. On average, their symptom scores were 0.12 points lower than those who didn't use the system. And this effect was statistically significant. But it didn't stop there. The GPNS also led to a noticeable improvement in personality functioning, with scores dropping by an average of 3.74 points. That is a pretty substantial effect, especially when you consider how complex personality functioning can be. What is even more interesting is that the system seemed to help people with more severe personality issues even more. Patients who started with higher levels of personality impairments saw an even greater benefit from using the GPNS. For example, those further away from the average personality functioning showed even larger improvements on both symptom severity and personality functioning. Now, even with clever designs, there is always a chance of hidden factors. So, they did a sensitivity analysis to see how much extra hidden influencing factors would need to be present to make their findings disappear. For symptom severity, the results held up pretty well, meaning it would take a fairly strong hidden influence to wipe out the effect. For personality functioning, the results were even more robust, requiring a strong hidden influence to make the positive effect vanish. So, what does all this mean? It means that introducing a system like the GPNS into routine therapy, especially when it is a clinic-wide policy, can genuinely improve treatment outcomes. It is not just a nice-to-have, it seems to actively help people get better, both in terms of their symptoms and their overall personality functioning. This suggests that when clinics mandate the use of these feedback systems, it likely leads to better results for their patients. However, it is also important to remember that therapists' buy-in and understanding are crucial. If therapists know why these tools are helpful and how to use them effectively, the benefits can be even greater. The finding that GPNs improved personality functioning is particularly exciting. There is not a lot of research showing that feedback systems directly impact this area, and the fact that it seems to benefit those struggling the most is significant. It might be that the increased self-awareness and insight gained from using the GPNs are especially helpful for people who lack self-knowledge. Of course, no study is perfect. This research was a natural experiment, meaning it wasn't a perfectly controlled trial. The findings are based on a specific group of people who went to this particular clinic, so we need to be careful about generalizing these results to everyone. Also, the effects seen are for a specific group of compliers, those whose treatment was influenced by the policy. This means future research should test the GPNs in different settings and with different types of therapy, and ideally through randomized controlled trials to get even more solid proof. But overall, this study gives us strong evidence that incorporating measurement-based care like the GPNs can be a powerful tool for improving psychotherapy outcomes. It suggests that using data to guide treatment isn't just a technicality. It is a way to help patients get back to feeling their best faster and more effectively. So, what are your thoughts on using technology to enhance therapy? Let us know in the comments below. And if you found this breakdown helpful, be sure to give this video a thumbs up, subscribe to RUBIN'S Mind Lab for more insights into the fascinating world of psychology, and hit that notification bell so you don't miss our next video. See you next time!